Hi, this is Vaibhav Vaidya with the Fits on the Go blog here at AHA 16 at New Orleans. We're joined today by Dr. Bob Harrington from Stanford. Thank you for joining us.
Thanks for having me.
So, Dr. Harrington, you're the only male member of the Women in Cardiology Council. How should male faculty support their women colleagues in cardiology, both at a personal level and also at a policy level?
So a little clarification, I'm the only male member of the WIC leadership group. I actually don't know if we have more men on the broader group, but not on the leadership group, but we need more men. And this is an important issue. I gave a talk last year at the ACC on how do you think about compensation in academic medical center. And one of the principles that I put forward is that it needed to be transparent and fair. And fairness really resonated with the women in the audience, several of them who came up to me after the presentation said, you know, we got a problem here. And as you probably know, the data suggests we have a problem in terms of disproportionate or non-equitable pay between the genders. So at that point, they asked me if I'd get involved at the leadership group. I was honored to do so, and I attended the Women in Cardiology leadership meeting back a couple weeks ago, maybe about a month ago in DC.
Great, wonderful. And so if any male fellows want to join the council, how do they go about doing that?
Go to the ACC website and look at the Women in Cardiology section, and there's ways to join, there's ways to get engaged. And I think it's a critical, important topic. I've been saying of late that this is not a woman's issue, this is not a men's issue, this is a cardiology issue. And what I mean by that is that we now have just over 50% medical students are women. You probably know that in internal medicine residency programs, we've got just short of 50%, 48%, maybe 50%. But cardiology fellows, 15 to 20% are women. And if you start looking at the more invasive specialties like interventional cardiology, invasive VP, it's even less. I think that's a serious problem because what it means is that we're leaving talent behind. That if we have 50% pool to choose from, but we're not getting that, that means we're leaving talent behind. And I think that it's important for the specialty that more of us get involved with this.
Wonderful. Thank you so much.
Do you have any advice for what fellows can do early in their careers or even as residents to make sure that they can have a career in big data or clinical research?
So let's take the residency piece first. I spend a lot of time these days with residents. And during residency, I think the most important thing is associate yourself with people who are doing research, because you don't have a lot of time. You might have a research block of a month here or there, but you don't have a lot of time. So get involved with a group. Go to their journal clubs, go to their conferences, maybe work on a small project, writing a review, for example, that you can pull together. As a fellow, I'd give you the same advice. Get involved in a group that's doing things that you're interested in. Go to their conferences, go to their meetings. But here's where I think it differentiates if you want to be a serious researcher versus someone who's supportive of research. If you want to be a serious researcher, you need to spend a year, 2 years, 3 years doing research. And my advice is that you spend about 2 years doing research and really doing a deep dive.
What tools do you think fellows should get in their toolbox before they leave fellowship?
So the first and most important thing you can do is get good clinical training, because the essence of a clinical researcher is you have to be a good clinician, you have to understand the clinical issues. Number two, get some sort of quantitative training, biostatistics, epidemiology, informatics, computer science, whatever it is that excites you, get some quantitative training, because the thing that really is going to differentiate clinical researchers in the future is it's going to be people who have a clinical understanding of the issues with a deeper understanding of the quantitative issues.
That's really good advice, to make sure that fellows are getting that clinical training in addition to these other tools that sometimes involves thinking outside of the box.
That's right. That's right.
So as you look to social media, what should fellows be doing to make sure they have a presence in that area as that continues to shape the future of medicine, especially academic medicine?
I gave a talk earlier in the meeting at one of the early career events. It was called Getting Your Name Out There. And I very purposefully talked about papers and grants and mentors, but then I left the last few minutes to talk about social media. I think you have to have a base on things that you're tweeting about or posting on Facebook or whatever the mode is that you want to do. But I think once you have a base, once you have some content, it's a great way to network. It's a great way to get your papers cited. I'm always retweeting papers that young people tweet out there to say, look, this is something worth taking a look at. I think it's a great way to network, connect with colleagues, and get your name out there.
And as we wrap up our time in New Orleans, any last minute places you recommend for people?
Well, if you haven't eaten at Mother's during one of your times here in New Orleans, you absolutely have to wait in the line and go have a debris sandwich. Not exactly heart healthy, but an occasional one won't hurt you.
Well, Dr. Harrington supports it, so we should all do that. Thank you so much for joining us, Dr. Harrington. For more videos like this, please go to www.youtube.com/fitsonthego.